Welcome to Nurse Practitioners Changing Practice. I'm Dr. Carol Berger, and I would like to welcome you to another episode of Thinking Like a Provider. We have another interesting patient, and we want to walk through it with you to see if you can help us solve the mystery. So let me share my screen, and we will get started. Okay, so this is Think Like a Provider. So let's see what we've got. So we've got Walter. He is 78. He has chronic kidney disease. He recently went to his urologist and he has a history of benign prostatic hypertrophy, but they put him on some medications and he's been doing better. However, when he was at the visit, the doctor noticed he had a small abscess in the suprapubic area and decided to drain it. And then he put him on some Bactrim DS. He woke up this morning about 3 days later and he's confused. He's got some slurred speech and he's weak. And his wife is a little worried. So she brought him into the emergency room because she's not sure what's going on. So, what are the key words we have in this story? First, he's got chronic kidney disease, stage 3. So that tells us his kidneys don't normally function at top speed, right? Next, he does have benign prostatic hypertrophy, so he could be having some urinary retention, which would make matters worse there. Finally, he was recently started on Bactrim DS. So those are the three things that we want to focus on. Bactrim DS is an interesting drug. It doesn't affect the filtration of the kidneys, so it's not actually hurting the nephrons in the kidneys, but what it's doing is it's holding on to creatinine. It's not allowing the body to excrete the creatinine like it normally would. That's a problem because it could make our creatinine rise, which in the setting of acute kidney injury and urinary retention would make matters worse, which could present the way Walter is presenting. But let's see what the evidence shows us. Vital signs are a little high. His blood pressure is 180 over 100. So that's up. Everything else looks pretty normal, except that we see his bladder is a bit distended. Other than that, he does appear weak. He does have some dry mucous membrane, so he could be dehydrated. But everything else looks fine. So what is causing his altered mental status? We get a clue from his wife, who reports that he is voiding in small, frequent amounts all day. And we do have another clue in the fact that in our physical exam, we see bladder distension noted. So our top three differentials for Walter would be, first, we need to rule out a stroke or a TIA because that could happen. He does have altered mental status. He is older. And, he does have some slurred speech. So we don't want to miss that. He could have an exacerbation of his chronic kidney disease by having an acute kidney injury. Or he could have urinary sepsis from a UTI. He is voiding frequently. So let's look at each one of these and discuss our pros and cons before we get into our body systems. So is the altered mental status caused by a stroke or CVA? Well, the pros are he does have altered mental status and his blood pressure is high. He also has some slurred speech, right? Cons are we can't really detect any neurological deficits other than him being confused and the slurred speech. He is, moving extremities on both sides equally well. That doesn't rule out a stroke, but that does give us some concern for pause. Acute kidney injury, well, our pros are he has a history of chronic kidney disease, stage 3. He was recently started on Bactrim DS, which we know can increase creatinine, and he is having weakness and confusions. There's really not a lot of cons there. That's probably something that's going on, but we'll have to verify that. Urinary sepsis, could he have urosepsis? Well, his wife has been reporting that he's voiding in small amounts. He is going frequently. He does have altered mental status, bladder distension, a history of benign prostatic hypertrophy. So it's totally possible that he does have a urinary tract infection that's causing his confusion. So here are the different systems that we can test, and we can see if we can get a little more detail so we can come up with what we think it is. Neurologically, what's going on? We did a CT of his head, and that was normal. Now, if he had continued deficits, the speech didn't clear up or anything like that, we could continue and get an MRI in the next 24 hours, which would be a little more conclusive. Cardiac, could it be some kind of a syncope? We didn't list that as our top 3, but he could have had an arrhythmia. But the EKG is normal rate and rhythm, and his cardiac enzymes, troponins, are negative ×3. So we can pretty well think that not a cardiac issue. Respiratory, he's breathing fine, his chest x-ray is normal, so probably not there. GI would be some sort of infection, but his abdomen is soft, bowel sounds are normal, there's no tenderness, no guarding. GU, we do have a urinalysis back that is negative for any kind of urinary tract infection, so that speaks against urosepsis. We do a bladder scan, which shows a distended bladder that has about 300 cc's post-void. Nurse tells us, however, that he has a hard time voiding when he's laying down. So we're going to check that again with him standing up if we can get him a little more alert. Musculoskeletal, he's moving all 4 extremities well, good strength, no drift. All of that looks good. Glucose, we're looking at that, and that's normal. Let's look at his other labs and see what those come up with. Now, these are the labs, a few months ago that we have to compare to today. Looking at the white blood cell count, that speaks against an infection. He is a little bit anemic, but he is at that age range where he could have some chronic anemia. It's not far from his baseline 5 months ago. Looks like it's a little bit of a macrocytic anemia, so not sure what's going on there, but that wouldn't be the cause of this. Sodium looks normal, so we don't have worry about that. Potassium is going up just a little bit, but it's still in the normal range. Glucose is fine, bicarb's fine. BUN and creatinine, I see a change of 1.25 5 months ago to 1.75. So that has increased. Calcium is okay, chloride's okay, and those are the tests that I have. So what is causing his confusion? Well, this is the evidence so far. CT is negative for stroke. There's no fever. White blood cell count is normal. His urine was negative for infection. Bladder scan shows he is retaining some urine, but we did get him up and he voided much better when he got up. The creatinine itself is elevated, which would be the case with a person who's started on Bactrim, especially in the setting of chronic kidney disease. So our diagnosis is Bactrim-induced acute kidney injury in the setting of chronic kidney disease with some urinary retention. So what is our solution for him? We are going to probably be able to give him some IV fluids, right? Might put a Foley in just to make sure everything drains real well, and stop the Bactrim. And in Bactrim, after two days, will probably have been flushed out of his system well enough that his creatinine will return to normal, which will clear up his confusion. And that's what happened. So thank you for being with us tonight and solving another mystery and thinking like a provider. Be sure and check out our website, npschangingpractice.com. We're doing lots of cool things there. We are putting up new games and new study material and help for you as you progress through the program and into practice. Bye, everybody.